Ladies and gentlemen, good afternoon. My name is Neema Grace Mutemi. Many warm greetings from the Kenya National COVID-19 Food Security War Room in Nairobi. We welcome you to this webinar today that has been made possible by several partners whom I shall now acknowledge. First and foremost, we acknowledge the support of the Kenyan government through the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, led by the Cabinet Secretary, Honorable Peter Munya, Chief Administrative Secretary, Ann Nyaga, and the Head of the Agri-Nutrition Department, Jane Wambogo. Secondly, we acknowledge the technical support received from the Food and Agriculture Organization of the United Nations, FAO, whose offices are the Kenya Country Office in Nairobi, Sub-Regional Office in Addis Ababa, Regional Office in Accra, and the headquarters in Rome have all worked closely with the ministry to develop the Healthy Diets Guidelines for COVID-19. We are, of course, honored to be joined by Professor Anna Latte, FAO's Director of Nutrition, on this webinar. Thirdly, I would like to acknowledge the World Bank. We have received tremendous support for this webinar from Ms. Natasha Hayward, the Global Agriculture and Food Security Program Head, who will be ably represented on the panel by Mr. Vinay Kumar Vutukuru. The World Bank is supporting Kenya and at least 14 other countries in strengthening their nutrition response to COVID-19, and we look forward to hearing more about that. Next, we acknowledge support from the International Agri-Food Network, whose president, Robin Anderson, has worked diligently behind the scenes assisting to coordinate the different organizations represented here today. The International Agri-Food Network have graciously supported us by providing the capable moderator, Dr. Lami Ngwenya. Dr. Ngwenya is a senior lecturer at the University of Free State, South Africa's Center of Sustainable Agriculture and brings a wealth of experience in moderating global panels such as the one we have today. We also acknowledge Nestle, who co-chair with the Ministry of Agriculture a public-private partnership platform for nutrition linkages. As we'll discuss today, nutrition security requires a multi-sectoral approach, and Nestle will share their experience so far. Globally, Nestle have been actively engaged in promoting the nutrition agenda through their participation in the World Committee on Food Security's private sector mechanism. Last but definitely not least, I would like to thank the National Business Compact on Coronavirus for their ongoing collaboration on the 1 Million Kitchen Gardens campaign and for hosting this webinar on their YouTube platform. I believe this initiative will assist to bring more private sector actors on board. Ladies and gentlemen, without further ado, I now hand over to Lami to take us through the webinar on Nutrition-Sensitive Food Systems Response to COVID-19 in Developing Economies, the case of Kenya.
Today we are battling with COVID-19, which is affecting everybody in the world. The question that we are asking, as we find responses to COVID-19, how do we ensure that our food systems are nutrition sensitive? This is at the heart of our discussion today. The topic from today is that how do we ensure that our food systems responses are also nutrition sensitive? This is at the core of our discussion today, and we are picking the case of Kenya to see, okay, fine, how within the Kenyan context, how are they actually doing things? On that note, let me introduce our beautiful panelists. We have 4 excellent panelists that I would like to introduce you to. Okay. Firstly, Ms. Ann Nyaga, who is the Chief Administrative Secretary in the Ministry of Agriculture, Livestock, Fisheries and Cooperatives in Kenya. She has a lot of experience on issues of food security, but also spearheading the youth element, as she wears a lot of many hats. She's a farmer. She's a political influencer or head. But unfortunately, she's not with us today because she's taken ill. But we have somebody within the department that is going to be Jane Wambugu, who's going to represent her. She's head of nutrition in the ministry. Our second panelist that I would like to introduce is Professor Anna Latte. I'm very delighted to be introducing her. She's a Director of Nutrition and Food Systems Division in the Food and Agriculture Organization, all the way from Rome. She has a lot of experience as a practitioner, as a researcher, as an academia, but also in the policy environment within food and nutrition. She did her doctoral degree in California, USC Davis in the US, but she also studied in Canada. And she worked a lot in sub-Saharan Africa for almost 27 years as a researcher. So she has a lot of experience that we're going to tap from. Our third speaker, as we talk about the issues of COVID and response strategies, there is no way we cannot talk to financing institutions. I would like to introduce our third speaker, that is Vinay Vutukuru. Thank you so much. He's a senior agriculture economist at the World Bank, but he's based in Kenya, and he's an anchor for the agriculture portfolio for the World Bank in Kenya. He has a lot of experience around issues of agriculture and rural development, but also the nexus between agriculture and nutrition. He also has a lot of experience on issues around, governance, and we're gonna hear from him about, his perspective from the financing institution. Last but not least, we cannot talk about issues of diet, nutrition, without hearing the voice of the private sector. In our midst, unfortunately, you won't be able to see him like me, but he is here. We have Mr. Ngetu Njeru. Mr. Ngetu Njeru, he's the managing director of Nestle East Africa. He has a lot of experience in terms of, business, and he's also coming from the farming community. So he's not only talking about, Nestle's experience, but also as somebody who's coming from the farming community, he'll also understand better the issues that we will be discussing today. Without any waste of time, we will go straight to our panelists. What I'm going to do, I'm going to pick a panelist, ask them 2 questions, and we'll give them an opportunity to talk. As we all know that charity begins at home. So I will start with the ministry within the government of Kenya. We know that the government of Kenya has been keen to ensure that disruptions to the agri-food systems chain, it's very minimal. And when developing, those action plans to minimize the spread and the impact of COVID, we would like to know how the government is actually handling the issues of, the interaction between food security and nutrition. Ms. Jane Wambugu, your 2 questions that I would like you to respond as you talk to the listeners is, how can African governments in general, but using what you are doing in Kenya, how can you foster synergies for successful implementation of nutrition in agriculture action plans during COVID? Please do share with us your experience from Kenya. But the second question that I would like you to look at, it's the whole issue of nutrition sensitive policies and programs. How do we ensure that aligns with existing national food-based, dietary guidelines and other legal frameworks so that, there is alignment. How are you doing it in Kenya? Over to you.
Thank you, Lama, for this opportunity. First and foremost, on behalf of our Cabinet Chief Administrative Secretary, Ann Yaga, I wish to welcome all of you in this very critical and important discussion we have today. I have the two questions, and thank you, Lama, for that. Let me start with the issue of fostering synergies and what we are doing in this country of Kenya. One, we are looking at how can we reduce malnutrition, and especially from agriculture production, from food production perspective. And that's why we are talking about nutrition in agriculture. In Kenya, we have a food and nutrition linkage technical working group. In this food and nutrition technical working group, this is where we get all the stakeholders, both the national, the government actors, the regional bodies also, like IGAD, and also all other non-state actors, and also the civil society come on board. We meet monthly, and we are able to learn what program each and every organization is taking up on. And from there, we are able to make plans on how to build on each other's activity. So this one has helped us, even at this time of COVID, to develop the national action plans and guidelines to respond to COVID-19 in terms of nutrition in agriculture. And this is where we are looking at how the farm families can preserve their food, whether in urban or in rural setting. And we are also able to understand what is in that forum, the synergies help us to understand what are the drawbacks and where do we stop replicating various activity. We know that nutrition is multi-sectoral in the sense that no one organization can deal with the nutrition issue. No one actor can manage nutrition. And based on what we have just recently concluded, the study that has been done on cohort studies, that is cost of hunger studies in Africa, the Kenyan report actually tells us, it has shown that there's need for us to work together in terms of each sector is really from the production sector to education sector to health sector. Each of the sector has a role to play. And this is why the synergy part of it, we are working together, and we meet monthly, even to developing the action plan that will help the country move forward. Even under this COVID-19, even post-COVID, we can still work, and we are still working together. The private sector is also not left out, and we have a public and private sector initiative in which we look at what is the private sector doing in terms of food processing. How can they also, even where they are buying the produce, can they also improve the farmers' nutritional information and nutrition knowledge? So in terms of fostering, yes. The second question, yes.
Just keep it short, then so that I can give other speakers, and then I will come back to you again. Yeah.
Thank you. Yes. The other question was on the
alignment.
Yes, how we are aligning to the issue of multi-sectoral coordination among the various actors, and also aligning the programming. For example, all the programs we are getting in agriculture currently have nutrition mainstreaming, and we thank the partners who have really looked at it. The World Bank has come out strongly, and other partners also to mainstream nutrition in their programming, and this is facilitating a lot of government effort in terms of making nutrition work for the for the community, and especially the farming community and the urban also communities, especially the vulnerable and marginalized. This is why under the COVID response, we are talking of 1 million kitchen gardens, because we feel that based on the stepwise survey, it shows that the consumption of fruits and vegetables in Kenya is very low. It's marginal, and this is why we need to grow the vegetables to make them accessible for the community. Thank you.
Yes, I like the whole issue of 1 million kitchen gardens. Thank you very much. We'll always come back to you. Let me go to our second panelist of FAO. I know that the Food and Agriculture Organization is actually calling for member states and everybody to look at the agri-food systems, looking at agriculture from fork to farm. But also you are also calling for the increased effort for the food value chain function to be part and parcel of the thinking of agriculture productivity, including the issues of diversification, food safety, and nutritious food for all. Prof. Anelate, your two questions are as follows. What support is FAO providing to member states to respond specifically to the challenges of food, of nutrition security? And secondly, what kind of transformation do you want to see from the different countries like Kenya and other African countries in terms of promoting healthy diets?
Okay, thank you very much, Yami, Madam Moderator, and thank the government for inviting me to give this, to be on this panel. Very grateful. I'd like to take the first question. We all know that this COVID started as a health crisis, and immediately some measures were put in place. These measures immediately led to, in some places, markets were closed, restaurants were closed. You know all the aftermath of what happened. But the point is, even though these measures were needed to actually contain the virus, these measures had other unintended consequences. And if not well addressed and managed, this health crisis can easily descend into a food crisis. And that's a big problem if that should happen. We saw the disruptions in livelihood. We saw disruptions in the production of perishable products, and in some places, even good nutritious foods had to be thrown away because there was no market. So what did FAO do? FAO, as a leading food and agriculture organization, became the global voice, telling countries and assisting countries on how to mitigate these actions to avoid turning this health crisis into a food crisis. We had discussions on the impact of COVID on global trade, food value chains, food waste, social protection, and especially how to maintain a healthy diet during this period of COVID. I think one of FAO's key message that has been taken by countries, and I quote, this was in one of our briefs, was that restricting trade, especially food trade, is not only unnecessary, but it will hurt producers, it will hurt consumers, and even create panic in the market. So during this COVID, we need to do whatever we can to ensure that our systems, our food systems, food value chain is working. In Kenya, for example, FAO is part of the UN country team looking at the socioeconomic impact of COVID on agriculture, rural livelihood, and also on food systems disruption and what can be done. So that's my first question. The second question, in terms of what kind of transformation are needed in countries like Kenya to promote healthy diet, I'll say that COVID has taught us something. One important thing we have learned from COVID is that the way we eat matters. Scientists who have been, and doctors who have been working with coronavirus patients have shown that those who are losing the battle to coronavirus have an underlying age-related chronic problem, mostly caused by obesity, diabetes, hypertension, and heart diseases. These are all related to obesity. So that means that the way we eat is very important. So maintaining a healthy diet, not only during COVID, before, during, and after COVID is very, very important. There is a global call for us to shift the way we eat, move away from the way we are currently eating. The representative of the chief from the Ministry of Agriculture in Kenya talked about diversity of diet. Absolutely important. We need to eat a diversity of diet. She also mentioned the lack of fruits and vegetables in the diet. It's not only in Kenya, in many places. They consume so many things, but fruits and vegetables are not consumed in adequate amount. We need to ensure that we are consuming a lot of these. Reduce the consumption of highly processed foods containing salt, sugar, and fat from the diet. And of course, drink lots of water. Now, this is the recommendation at the household and the individual level. But there's a lot that governments can do to ensure that healthy diet is available and accessible for their people. She mentioned about diversity of production, and I will mention again, a lot of countries, because of the hunger situation, put a lot of emphasis on the production of staple crops, cereals, to the point that cereals are so cheap and they have become the bulk of our consumption. We need to diversify our production, and this is a message to all governments, ministries of agriculture, to diversify and make sure that fruits and vegetables can also be affordable to the majority of the people. She mentioned food-based dietary guidelines. Very important. Food-based dietary guidelines are instruments that tells the citizens this is how we want our people to eat. I know Kenya is seriously thinking about developing this, and FAO stands ready to provide technical support in developing your food-based dietary guidelines. We need to support our smallholder farmers. Smallholder farmers are the ones who produce the nutritious foods, which tend to be highly perishable. We need to link them to markets, provide storage facilities for the foods they produce. We need to also reduce food losses and waste in the supply chain. Some countries are looking at this, we have heard, or as I mentioned, some farmers are throwing food away because they have no market. We need to support our small farmers to reduce losses and waste. I want to make a plea for women. Women in production contribute to the nutritious foods of the household. We need to empower women farmers with credit facilities, extension services that will help them, produce the nutritious foods that will keep a nation healthy. Let's think about the small, medium enterprises, the SMEs. With urbanization, a lot of people are eating outside the home. The SMEs who are in food production, they are actually determining our nutrition. They need to be capacitated. They need to be educated on how they can offer healthy diets for people. In FAO, we have a project, which Kenya is one of them, where we are training SMEs to make their businesses not only profitable, but to make healthy foods healthy. We need to also empower consumers. You and I, we should have control over what we eat. We should decide what we will buy and what we will not buy. Make use of the food labels. Read food labels. If the food is not nutritious, don't buy it. We as consumers have a lot of power to determine really what producers will produce for us. Let's educate ourselves and really make this possible. We also have to maintain healthy eating all throughout. And I'm happy to see the Kenya brief on sustaining healthy eating at the household level. It's a wonderful brief. It's very comprehensive, and I'm hoping that you share it with other countries. It's really useful, and let's make good use of this brief. But it's useful and it provides guidance for consumption, not only during COVID, but throughout and after COVID. I congratulate you for producing this brief. Thank you very much. I'd like to end here for now.
Thank you very much. As I'm listening to you, I can hear that you are putting responsibility not only on government, but the responsibility is on everyone. Even the people, the women, we have to support them, but also consumers also have the responsibility in order to in changing the status quo. Okay, we will take up, some of the discussions later. Let me move and talk about the ching ching, the finances. We know that, COVID-19 puts household diets at risk. You know, we know that, jobs are threatened, income, it's lost. We hear the statistics from Kenya, as we are talking about Kenya now. We hear that in Kenya alone, there are about, 500,000 jobs that are at stake as a result, of COVID. I would like to hear from our next panelist, Mr. Vinay, as you're working from the World Bank. I would like to hear your perspective from the financing institutions. I also have two questions for you. The first one is, how is financing institutions such as the World Bank restructuring its loans to African countries actually to support the local economies in their efforts to put nutritious meals on the table, especially for economically marginalized communities? So how are we restructuring, your loans to those countries? Secondly, it's an issue of the buying power. That is a challenge. So what recommendations would you give to financing institutions for them to be able to fast track, the inclusion, especially inclusion of the marginalized people, and for them to positively influence, the whole production, value, and supply chains with the healthy diets of urban and poor people at the core? So two questions. The first one, how are you restructuring the whole issue of, the loans? And secondly, how are we strengthening, the buying power of the marginalized people?
Thank you, Lama. So, first of all, I would say that I just want to qualify what you said. We are, of course, a financial institution, but I think we also pride ourselves with the fact that we are very, very focused on knowledge and technical support that we provide to clients. So, I think we are beyond just a financial institution. But I'll come to the two questions that you've asked. We at the World Bank globally have kind of, given the COVID crisis, have really learned from how previous pandemics and episodes like the 2008 food crisis has had an impact on malnutrition, and come up with a kind of an approach which I think the heart of it is multi-sectorality. And as Jane rightly said, I think for us, it's very clear that any approach that we would like to promote, and any financing and technical support which we provide, needs to have a comprehensive nature to it, including agriculture, health, education, social protection, women's empowerment, financial inclusion, because unless you approach it from a multi-sectoral perspective, you'll not be able to address the food and nutrition security issue. Now, specifically, if you look at the Kenya World Bank portfolio, we've been in discussions with the Kenyan government to make a number of tweakings or restructurings to help the government of Kenya respond to this trend. And and I just want to inform you that this restructuring is across all these sectors: agriculture, social protection, financial sector, also education, health. But what I'll do is, in order to save time, I'll specifically focus on few of the restructurings that we are doing in specific sectors. I'll first come to the agriculture sector that I anchor here in agriculture in Kenya. So we have two projects, the National Agriculture Rural Inclusive Growth Project and the Kenya Climate Smart Agriculture Project. So what we've told the government is we can restructure both the projects, and we can promote elements, focus more on elements related to food and nutrition security. And that in itself can release something like $25 to $30 million of financing specifically for this issue. In addition, in Kenya, there's a crisis within the crisis. There's also the locust attack, which has meant that northeast parts of Kenya are also severely impacted by that. So what we're doing is we prepared an emergency project of in just 15 days, a $45 million emergency project. 50% of that financing is focused on addressing food and nutrition security and restoring livelihoods in 12 of the most impacted counties. On the social protection side, we're supporting a national safety net program and a hunger safety net program. And we're willing to restructure both the programs. These programs were originally, for example, the HSNP, the Hunger Safety Net program, was originally designed to, respond to drought. But we are saying that let us, consider COVID as an equally, big disaster, and therefore restructure it to allow, food and cash transfers to happen to the most marginalized communities. So this is on social protection. So similarly, we are also trying to restructure our projects in the financial sector, projects in the education and health sector to be able to respond. And most importantly, I think in April 2019, the World Bank gave a $750 million loan to government of Kenya with the commitment that there are certain reforms that are to be undertaken. And one key such reforms is in the area of food security, where the government of Kenya is reforming the way fertilizer subsidies and input subsidies are provided and using a digital e-voucher, and also restructuring their strategic food reserve and the National Cereals and Promotion Board to allow for greater private sector participation. And that really improves the choice for the most marginalized communities in terms of accessing food and nutrition. On the second question, in terms of what the banks take is, first of all, a rider that I'm not a financial sector person, I'm an agriculture economist. But I think what the bank has said is, in general, if you look at the world, countries which have had strong digital financial services are better placed to respond to this crisis and respond in terms of cash transfer to communities and which will help communities overcome food constraints. So in that sense, Kenya is well placed because of the head start it has on digital financial services. Lastly, I would say the key in terms of the financial sector, I would say constraints, is to really solve working capital needs for small and medium enterprises, specifically in the agriculture, food, education, health sectors. And I can give you a specific example. Here in Kenya, we are working with 15 agtech startups who are partnering with 16 counties on a digital 1 million farmer platform. Now, all of these 15 agtech startups have really had problems in terms of working capital issues because of the COVID. So I think if banks and other financial institutions, local commercial financial institutions, can come up with financial products which will help these SMEs, specifically in the agriculture sector, to tide over this difficult phase, it will automatically mean that the entire supply chains, whether it's the input markets or the output markets, will be much more active and will be much more responsive to the COVID crisis. And that in turn will put more money into the hands of the marginalized communities, the farmers, so that they are able to overcome the COVID crisis. So I'll stop here.
Thank you so much.
What are the things that the bank is doing? And thank you for providing me this opportunity.
Okay, thank you so much. Let's see if we still have time. I still want to pick, your brain on certain issues. Let me take this opportunity to call upon our last, panelist, that is Mr. Ngentu Njeru. He'll be talking on the perspective of the private sector. I have two questions. I know private sector is hit the most with COVID. My questions to you, firstly, I would like to know how Nestle has responded to nutrition challenge in Africa in general. And secondly, specifically relating to COVID pandemic, what kind of strategies has private sector in Kenya or maybe other countries where you are implementing? What have you employed to actually mitigate, the economic impact while supporting government efforts to ensure continuity in the provision of safe and nutritious food for consumers?
Okay, thank you, Lami.
Yes.
It's truly appreciated. So I'll put it into perspective by first talking about two key things. One is that when you're in the private sector, it means that when you're in the food industry like Nestle, then you're sourcing your raw materials directly from farmers, which we do in Kenya.
Yes.
Yeah, so Nestle is involved in coffee and in beverages and many other food products, and those come from our farmers. Yeah, so for the first thing is that we have to ensure that there's a clear sustainability of the value chain from top to bottom, because you need those farmers to be there. You need them to be healthy.
Yeah,
and so our commitment is to obviously have to improve food availability and dietary diversity among the farmers who supply us. If we also look at the big four agenda in Kenya, you'll see that one of the major one coming up is also on food, nutrition, and security. Which is again in line with exactly what you're doing. We've seen a lot of agricultural programs in the past have focused on yield and product quality and improving the quantity of the yield, etc. In order to improve incomes. But the issue of diet and health is often left out. So we did an assessment with the farming community globally and found that almost 30 to 70% of farming families in any one country appear to be short of at least 3 months of food. So where we have a lot of cash crops coming through, but before the harvesting is done and the food goes all the way to the end of the value chain and the farmer receives the money, then there are those blank periods where they're not, the farmers are not getting access to any money. So it means that at that point they are food insecure.
Yes.
So in line with that, what we tried to do is we took an approach of trying to address this challenge. And we came up with a few interventions that we did pilots in Kenya to ensure that not only farmers can feed themselves, but also they are able to have diverse, nutritious foods within their diets. So I'll talk about 3 specific things that we looked at. One was on ensuring that there's food availability. So we worked with farmers to get a good seed supplier at good price. And with these suppliers, we were able to set up kitchen gardens. And in these kitchen gardens, in these kitchen gardens, we were able also to promote indigenous vegetables for consumption, because then again, we are seeing that the issue of fruits and vegetables is often left out in the diet. And we also shared with them a planting calendar for a full year planting calendar, where they can actually see what fruits and vegetables they can grow throughout the year. That was to help on the issue of food availability. The second part we looked at was on dietary diversity and health. So our approach here was again to try and get both male and female, woman and man in the family to look at the aspect of making food choices, because most often it's left to the women to make the decision on to what is consumed. And when they do, sometimes you find that the finances to get that done is not availed, and people end up just eating one type of food or two basic types of food categories, which again causes the lack of proper nutrition. So then when we got the two, both the man and the woman in the house, we taught them how to do to cook through cooking demonstrations, and helping them develop their own tasty balanced plate of food. And by this, then we were able to address the issue of at least the choice, making the choice on the right foods, but also we were able to touch on issues on nutrition and health training through that cooking demonstration. And in line with that, we also had some programs within schools where we did the same kitchen gardens to also teach the kids on what are nutritious foods, what are the food categories that we need to be eating on a daily basis for us to be healthy. And what was taught in school, married with what, again, was being taught at the home front, has really helped them to really analyze and understand what are the important things around nutritious, healthy eating.
Thank you. The
third thing, once we taught now these farmers how to do these kitchen gardens, of course, there was at some point, there was going to be some surplus of the foods that they produced, which was then going to allow them maybe to trade the surplus with their neighbors, maybe in exchange for other foods, etc. But also we thought it's a good opportunity to bring a bit of entrepreneurship skills here, because then we will link them to the markets eventually and be able to trade off their excess foods, which then will also help them have access to some money that they can use, for the daily needs of their family. It will also help them to be able to see what are the important foods that you can actually plant that can help you have access to the market at any one time. As you know, that market in most of the African countries fluctuates a lot. So when it's in the season of plenty, everybody is producing the same thing, and you all go into the market at the same time. And you know what happens to the price. They hit rock bottom and nobody gains anything from that. But the key point here in conclusion was we wanted to ensure that we continue to improve the livelihood of these farmers, their families, and also their farm hands or workers. And the second part of it was to ensure that there is a clear, we are helping with on the resilience side and the prosperity of these farming communities. And the whole value chain, stakeholder value chain across.
Okay. Thank you so much. We have
brief on the second question.
Just be brief so that I can still be able to take some questions from the audience. Yes. In brief. In brief.
So I'll keep it very brief as well. With the whole COVID situation, it's obviously affected a lot of businesses a lot. I think for us, the one thing that still remains is that we still need the farmers. The value chain has to still continue. So we need the produce that is coming from the farmers. But also on the other side, we need to keep the operations running at the factory front to produce whatever it is that comes from the farmers, and to also go a step further and ensure that these products are actually availed on the shelf. So what we've done is that there's a lot of safety measures that we've taken on our factory workers, on education, and equipping them with the PPEs and just passing on the education on what they need to do during this COVID period, how to take care of themselves and their families. We've extended these again to our very able suppliers who we need to also get products available on the market. So we have many suppliers across the value chain. So we are also helping them to ensure that they survive this period, because again, it's a difficult period that has seen also a lot of smaller businesses closed. So we are supporting them financially to remain afloat. whether it's paying earlier or whatever other interventions that we make. It's all in an effort to ensure that our suppliers also continue to remain afloat and in business.
I just want to pick from the discussion so far some common threads that I'm picking from all of you, maybe just keywords that excite me. For example, when I look at what Jane has mentioned, she's talked about the 1 million kitchen garden, which I love so much, and we have to see how that goes on. But on that same breath, Mr. Njeru also spoke about the kitchen gardens. So what I'm wondering is how is the linkage between the kitchen gardens that Jane spoke about and how that links with the kitchen gardens that Mr. Njeru spoke about. But also something that I'm picking that is very exciting here, it's what Prof. Latte said. I like these slogans. One of the slogans that I'm seeing here or I'm hearing is that how we eat matters. Not only what we eat, but how we eat matters. And as she has indicated that, the people that are more likely to survive, COVID, it's also linked, with, the diet and all that. I find it very interesting. But also when I look at, listen to what Vinay said, the whole issue of comprehensive package that is multi-sectoral. I've just picked that and thought, that is very interesting. Do we have any question from audience? Just quickly indicate who you are and whom you are directing your question to. Okay, while we are still looking if we have any questions, I'll go back to you again, Mr. Njeru. You wanted to have that final statement that I interjected. Just go ahead, just in 1 minute, just to finish what you wanted to say about the last part of the second question. Mr. Njeru?
Yeah, sure, thanks. So just two things I wanted to say in conclusion. One, I think when you look at Africa in general, you find that there's a lot of malnutrition deficiencies, or rather nutritional deficiencies. And fortification of our products becomes a key thing to do then when we're delivering products to the market. Yeah, yes. So we know the key deficiencies around iron, vitamins, zinc, and iodine. And so what we try to do with the various products that we put forward in the market is to ensure that they are fortified so that at least they have that extra benefit. Beyond just consuming, then you have the extra benefit from it. But lastly, I think when you look at the COVID situation that we are dealing with, I think it just shows how delicate the food system is. And that food system needs to be really, really resilient to global shocks. I think we'll still have many shockers coming forward because of either supply constraints or production constraints. And the most important is how then do we work with our stakeholders to have a positive impact and support the transformation of the global food system and ensure that it's well greased and working properly.
Okay,
that was thank you. From my end. Thank you.
Thank you so much. I don't see any question from the audience. As a teacher, when I ask my students to ask questions and they don't, I make two assumptions. Is that it's either they have understood everything, they don't have anything to ask, or they did not hear anything that they don't know what to ask. But as we conclude, I would like to ask each one of you, my panelists. We do have a question, yes, okay.
Questions actually. So Rose Mukonyo, you're unmuted, so you can speak.
Yes, Rose, over to you.
Yes, thank you very much.
Thank you, Rose.
Yes, thank you very much. Yes, I am from Radio Maisha, the Standard in Kenya. And my question goes to the lady from the ministry, that is Jane Wambugu. Apart from planning to network with other sectors, the way that she has said that the government is planning to work with every other sector to make sure that the people have enough food, what has been done so far to the people living in the rural areas to ensure that they have sufficient food, and not just sufficient food, but nutritious food? Thank you.
Okay. Thank you so much. Jane, maybe just a quick response to that. What have you done so far to make sure that the people in the rural area have sufficient and nutritious food?
Thank you. One of the things we have done is we have programs that are targeting even climate resilience in the rural areas. We have climate smart agriculture, we have national agriculture and rural inclusive projects, and this one includes even targets mainly the vulnerable and marginalized households to be able to establish and produce crop for their own consumption as well as for the market. Also government support in terms of also taking care of small grants that are meant to improve their nutrition component, especially in the national and agriculture and rural inclusive and growth projects, which is also worldwide funded project, has a component that targets that for any project that comes, any proposal that comes from community, it has to have nutrition aspect, and they have a budget and it is funded as a grant. So there is targeting, there is proper targeting at the community level so that they are able to produce food at that level.
Thank you. I see, I'm looking at my time. I don't think I will still have more time to take questions. In the next 2 minutes, I would like to go back to my panelists. We have 2 minutes, so it means that we're going to each share maybe that 2 minutes in 30 seconds. What are some of the major highlights within these discussions, some last statements that you want to say? Let me start with the ladies. I'll start with Prof. Anna Latte. What are your closing statements in 30 seconds? You have to unmute yourself. We can't hear you.
I've unmuted her.
Yes, okay, yes, please go ahead. Yes.
Thank you very much. So I'd say that, coronavirus is a horrible situation, that we don't want to see this again. But let's take advantage of this unfortunate situation and do things differently. We're doing a lot of things wrong. We have the opportunity to change things, make our food systems work better for healthy diets. And then secondly, this is second for the Kenyan government. I really support your quest to develop food-based dietary guidelines. FAO stands ready to support you technically. So you have food-based dietary guidelines to support your citizens to eat healthily. Thank you very much.
Thank you. Let me go back, to the global. So I will ask Vinay to have your closing statement.
Yeah. Thanks, Doctor. And I would just want to say that extraordinary times call for extraordinary measures. And I really like the government's emphasis on 1 million kitchen gardens. And based on my own experience, I would just say 6 words: 3 S's and 3 C's. I think you need to simplify, standardize, and scale up. And you can do that by collaborating, collectivizing, and communitizing interventions. I think that's the way to go for us.
I love, those short, statements, SSS, CCC. I love that. This is something that I will remember. Jane, what is your closing statement?
Thank you. I wish to thank, yes, I think it's okay now.
Go ahead. Yeah, go ahead.
Yeah, I take this opportunity to thank the World Bank, the Fine Kumal, the Professor Latte from the FAO. Thank you very much for the support we have received from FAO in terms of making dietary and also improving on our dietary guidelines and also our dietary response. Thank you very much. Also, the private sector. We have worked with Nestle on public and private sector initiative to see where they come in. Thank you very much. My closing remark is we are looking for increased commitment to actions of nutrition in agriculture so that we can start from production and also responsible investment so that there is also a dialogue. We have, as I had said earlier, we have these national monthly meetings where we are dialoguing and we are able to utilize that opportunity to deliver on what we are already supporting the government on. We thank you for the support. We wish to see more of our community having healthy and nutritious food on their table. through production
Okay.
and food system. Thank you.
Thank you so much. Last but not least, Mr. Njeru, what is your final statement in 20 seconds?
Okay, so as earlier mentioned by Jane, she said that this approach of addressing nutrition is a multi-sectoral, needs a multi-sectoral approach. So it means that all sectors have to work together, the private and government. In some cases, as she's mentioned, clearly we've tried to work with government on how to scale up. So we might have the know-how, but the scaling, we might need that government to sort of step in and help to do that. Because across Africa, we find that a lot of farming is subsistence and the quality is not good. So once we're able to scale up these projects and touch as many as possible, then I think it will be one step forward towards addressing the nutritional risk in Africa.
Yeah, thank you very much. I think we have come to the end of our session today, and thank you very much to my panelists and the organizers and our wonderful audience. I hope we will have an opportunity to organize another follow-up, so that we see how we are actually faring within, that, COVID and all the things that we are trying to implement. Thank you very much. And thank you very much also to our listeners out there. Bye-bye and God bless.
Thank you.
Thank you. Thank you.